Good evening, everyone. My name is Lisa Vogt and I'm from the University of Otago. I would like to start off by wishing all our guests here a very warm welcome to tonight's Winter Lecture Series event. And I would also like to thank Minister Woodhouse on behalf of the University for agreeing to host the 2016 Winter Lecture Series. The University is honoured to again be able to host the series here at Parliament Building, so thank you very much for this opportunity, Minister. This year's series is presented in association with the Health Research Council of New Zealand as it celebrates its 25th anniversary. Looking beyond the immense contributions to research funding within the New Zealand health sector, in its 25 years, the HRC has played a key role in creating the collective knowledge network New Zealand needs to be healthy and strong. Now, with that said, the University of Otago has a long association with the Health Research Council, and many significant research projects have benefited from the funding received from the organisation, which have in turn enabled Otago's health scientists to take even greater steps in their research endeavours. Funding received from the Health Research Council is vital to the continuation of the extremely high standards of research that continues to predominate at the University of Otago. I would now like to introduce the Honourable Michael Woodhouse, who will introduce tonight's lecture. Thank you.
Lisa, thank you. Kia ora, everybody, and to those familiar faces in the room, welcome back. It's my great pleasure to host the 2016 University of Otago Winter Lecture Series, which kicked off so emphatically this time last Wednesday. And I know we're going to have a terrific evening tonight, continuing what has been so far a health research theme, which I think is entirely appropriate because, as I said last week, I'm unashamedly proud of the work that is undertaken, the teaching and the research at the University of Otago. But I also think we have one of the world's great health science faculties. And we probably don't say that often enough, but with medicine, dentistry, allied health, clinical research into immunology, virology, you name it, we do it pretty well at the University of Otago, and I think we should continue to say that loud and clear. I also want to acknowledge the Health Research Council. The government sees health research as a fundamentally important part of research and innovation, and we were very pleased to be able to give their funding a bit of a boost in Budget 2016, as we did in the science and innovation field more generally. Before I introduce our speaker for this evening, can I just remind you of our emergency procedures. If an alarm should go or if the security team should ask you to vacate, please follow them and the exit signs. The gathering place for this part of Parliament is in front on the what you would call the east side of the parliamentary precinct by the Seddon statue. As you may be aware, these lights, there are lights behind me on each side of the stage. They will flash if we're still going for a short time at 7:20, and then for a continuous period from 7:25 to about 7:29. That is the call to the debating chamber for my colleagues, and tonight for me, because I'm rostered to be in the debating chamber from 7:30. So I do apologise in advance. I hope to be here to lead question and answers, and hopefully to thank our guest speaker, but I won't be able to join you for refreshments afterwards because of duty. Nevertheless, that will be my loss, not yours, I'm sure. It gives me great pleasure to introduce the second of our Winter Lecture Series speakers tonight, Professor David Murdoch. Professor Murdoch is based at the University of Otago Christchurch Health Campus. He's an infectious diseases expert and one of Otago's stellar researchers. He's currently head of the Christchurch Health Campus's largest departments, Pathology. This department is home to many world-renowned research groups and involved in the teaching of 4th to 6th year medical students. Having dedicated 16 years to his work at the Christchurch campus, Professor Murdoch has recently been named as the next Dean of the University of Otago Christchurch campus. Professor Murdoch has been involved in some of the most significant infectious disease research projects here and overseas. Projects include a global childhood pneumonia study funded by the Bill and Melinda Gates Foundation, and a New Zealand-wide Legionnaires Disease surveillance program. Professor Murdoch also works for the Canterbury District Health Board as a microbiologist, having been a Health Board staff member for more than 2 decades. He's a strong advocate of researchers and organisations working together to achieve greater and mutually beneficial outcomes. He's one of the leaders of One Health Aotearoa, which is an alliance between researchers working at the interface between human, animal and environmental health. His lecture topic this evening is One Health, taking a global approach to the control of infectious diseases, during which he'll discuss the inextricable link between the health of humans, other animals and the environment in the fight against infectious diseases. Ladies and gentlemen, please welcome Professor David Murdoch.
And let's do a sound check. I think that's coming through great. Thank you, and tēnā koutou katoa, and thank you, Minister, for the kind introduction, and thank you for coming along tonight. I see a few familiar faces, including a little bit of whānau support as well. I'm an infection doctor. What I do, my background is I'm trained to look after patients with infectious diseases and also to diagnose infectious diseases in the laboratory as a clinical microbiologist. And those of us who are working in infectious diseases, we're now faced with a time where the challenges of infectious disease, we really need to do things a little differently. The challenges we're faced with now are relatively new, and there's been a real, more than ever, a need to actually look at things in a slightly different way. And tonight I'm going to talk about one of those concepts which we tend to call One Health. It's a little bit of it's one of those concepts that's been picked up by a number of groups around the world, and in a way is a little bit of the flavour of the month, but is one that has some currency. It's also one that a lot of people, when they hear about it, go, well, that's kind of obvious, because a lot of it is about a holistic approach to tackling problems, in this case, the control of infectious diseases, and also about working with diverse groups, people from different professions. So in a way it's kind of obvious, but in a way that's something in health that we don't always do well. Now, infections are in the media quite a lot, and these are just some of the headlines from some recent publications. We've heard a lot about ZIKA virus recently and the ongoing concern about how that might affect the Olympic Games in Brazil. We've heard a lot about influenza over the years and the concerns that we're going to have another nasty pandemic. We've also heard a lot about Ebola and this huge outbreak in West Africa that has really shaken us in terms of the scale of it. And then also, quite recently, a lot of talk about antimicrobial resistance. So antibiotics that we've been using to treat infections often are not as effective as they used to be, as a lot of the organisms that cause infections develop resistance to them. So that's been a big concern, that we might be entering an age where a lot of the drugs that we use to treat infections, we just don't have the same armamentarium as we do at the moment. Now, infectious diseases, and I know we've got a broad audience here, and I think that when we're talking about infectious disease, we're talking about diseases caused by a variety of microorganisms, particularly bacteria and viruses. But we also have some infections of humans that are caused by fungi, such as the Candida yeast that causes thrush, and also by some parasites. And there's a picture of a Giardia parasite that can cause gastroenteritis. Another example of a parasite would be the malaria parasite causing malaria. And there are a number of features of infectious diseases that make them a little different from other diseases. One is the transmissibility. Here's somebody who's sneezing, and imagine if he has a common cold or measles or influenza, how easy that would be to transmit it. And so it's a characteristic of infectious diseases. They can be transmitted, some to other people. Sometimes we acquire infections from animals, and I'll be talking about that a little bit tonight. And then sometimes we even the other way, where animals may get an infection from humans. We don't talk about that so much. One of the other characteristics is many of the infections have the ability to cause large outbreaks that can have devastating effects on society and on psychological well-being as well. So picture on the left shows is an old picture of the plague, and in the Middle Ages it certainly had devastating effects on many societies in Europe and elsewhere, and also it created quite a stigma and a fear. And in fact, when the plague is still around, there are a number of reasons why we don't hear about it. It's not as common. But there was an outbreak in 1994 in India. And although it was relatively small and we have antibiotics nowadays to treat it, the psychological effects were quite marked, and some airlines actually stopped flying into India just because of this small outbreak, because of this stigma. And this is the death certificate of my great-grandmother. She died aged 49 in Sheffield in England in 1918, and you can see that the cause was influenza. So she was one of many millions of people who died in that Spanish influenza pandemic in 1918-19, where there were in fact more people who died of influenza than who died in the First World War, which of course finished about the same time. A lot of infections, common infections acquired from animals, and as I say, I'll talk a little bit about that. And there are opportunities for prevention for infections, and vaccination is one of the more obvious means of prevention. And if you get a vaccine that's effective to an infection, it's often a very cost-effective way of preventing an infection. And we've used vaccines also in the attempt to eradicate infections. This hasn't happened very often, and of course the most well-known example is that of smallpox, and that was declared eradicated in 1980 after a very intense vaccination program that interfered in civil wars and other adverse conditions to actually vaccinate the last people and eradicate it. And there is actually another human infection. We haven't heard a lot about it. There are 3 main strains of polio, and polio 3 has probably been eradicated. So one of the 3 strains of polio, that's probably the second human infection that's been eradicated in recent years. Now, my mother's a very fastidious ex-school teacher, primary school teacher, who kept my Plunkett book. So this is my Plunkett book, and as you can see, she's written when I had all these infections in childhood. Now, I don't think I'm necessarily that old. It's not that long ago, but this, as you can see, within a year and a half, I had measles, chickenpox, mumps, and whooping cough, and that was really common at that time in the mid-1960s, just prior to the introduction of a lot of the vaccines. And of course, nowadays, all 4 of those infections, there are very effective vaccines, and 3 of them are part of our routine childhood immunisation schedule. And so for a lot of them, we don't see much nowadays. We still have occasional outbreaks of measles and whooping cough, and measles particularly in populations who have not been vaccinated. But we tend to forget about the severity of measles, and this is in fact a child that I treated about 20 years ago in the mountains of Nepal, and this child had measles. And it was one of the most horrible experiences I've been in. It was a measles epidemic. The vaccine program had broken down, and there was an outbreak. And this was one of the fortunate child who actually managed to get to us. There were many children who died in the community. And we tend to forget that measles has been one of the biggest killers of children, and still is in many parts of the world. And another characteristic of infectious diseases, their adaptability. And I think probably all the microbes that cause them are very adaptable. And one of the more obvious ways that manifest is in the ability to develop resistance to antibiotics. And so this has become a real concern, that the pace at which these organisms are developing resistance, and the concern that we're not getting new drugs to actually combat them. Now, I'm not going to talk much more about antibiotic resistance because actually one of my colleagues, Greg Cook from Dunedin, is going to be talking in the series in a few weeks' time just on that topic. Now, in the late 1960s, there was a lot of optimism. There's a feeling that the vaccines were coming, were being introduced and were working, antibiotics were still working, and this man became famous for this quote. And he was a US Surgeon General of the time who said, "It's time to close the book on infectious diseases and declare the war against pestilence won." So he was famous because of how wrong he was. In fact, he went to his grave saying he couldn't remember ever saying it. But this is what we remember him for, the poor guy, because this is, of course, how wrong that is. And there's a very complicated graphic, but what you can see, you may not be able to read all the words, but what it shows is examples of what we call emerging or re-emerging infections that have occurred over recent years. And the blue ones are ones that are newly emerging. We didn't know about them before. They may have been there, we didn't recognise them, or they are completely new. The ones that are in orange are ones we've known about but have re-emerged. We thought they'd gone, they'd come back. And there's one there which is kind of an aqua, which is actually deliberately introduced, and that was the anthrax that was introduced in 2001 through the mail in the US. But as you can see, it's a very busy slide. There's a lot going on. Those of us in infectious disease are not going to be without a job during our lifetimes. And so there's a lot still happening. Now, we don't have Zika virus on there because that slide was made before Zika came around. And there's another one that's not on there as well. And of course, that's the Ebola from this recent huge outbreak in West Africa. And this has really shaken the world and global health in terms of the magnitude and the response and the required response to this terrible outbreak. And this graph, if you can read it, it shows a lot on it, but what you see over time, from the 1970s to the present time, it shows all the cases of Ebola since it was first discovered in the 1970s. And as you can see, the numbers are relatively small over time, little outbreaks. And then suddenly, in 2014-15, we get this huge outbreak, and mainly focused on 3 countries in West Africa: Guinea, Sierra Leone, and Liberia. And when we look at it, the virus seems to be behaving exactly the way. It's caused by a virus, and it seems to behave exactly the same way as it has in the past. And so we suspect what's different. There's something about human behaviour that's being related to the magnitude of this outbreak, and probably related to the contact with the animal sources of the virus. It may be the way we get much easier to move across borders, to move into large urban centres. That hasn't happened before, and spread the infection. But it's something about human behaviour that's probably more than the virus itself that's led to this huge outbreak. Now, the World Health Organization and others have been majorly criticised for their response to this outbreak, being a bit slow or not directed in the right way. And in response, the World Health Organization put together this meeting at the end of last year in December. And they invited about 100 people from around the world, and I was one of 2 from Australasia to come to this meeting. The idea being to actually brainstorm and look at ways that perhaps responding to epidemics and actually detecting them in the first place, we could do it better. And there were health professionals, there were vets, there were people, there were meteorologists who are good at predicting things, there were people in the travel industry, there were people from non-governmental organisations and charities. There was a hugely diverse group of people. And they basically put us in a room for 2 days, and each given 15-minute slots to talk about designated topics, and a lot of time for chat. And it could have been a talk fest, but actually it was a very productive meeting. And the minutes were taken by this Canadian guy he's a graphic artist, called Sam Brad, I think is his name. And he stood there with his back while everyone was talking, and just basically drew what was happening. And here's so I've got a couple of slides. This is just one of them from one session. These fantastic graphic representations of what we talked about. And these are really busy slides. You probably can't read a lot, but you'll get a sense of the kinds of things they're talking about. This was the introduction, and it talked about diverse groups and the importance of community empowerment and involving lots of people in decision making, and that the old ways are not necessarily the right ways. We need to move on and be a bit more innovative in our thinking. And the session that I was involved in, again, it's a bit hard to see, there's a lot of discussion about the human-animal interface, where the vets were talking about the importance of collaboration and talking with the human health people and the different systems and types of research and surveillance that was used, and the people involved in ecosystems. So it was really emphasising the importance of a diverse group of people trying to tackle problems in different ways. And the last talk was by David Nabarro, and it was it had a profound influence on me. And in fact, I must say, it also had an influence on me applying for the Dean job, I must admit. It was a lot of talk about leadership, and sort of the penny dropped that week. But David Nabarro is the United Nations Special Envoy on Ebola. And he came from the Paris Climate Conference just to talk to us at the very end. And he sat there and he said, I'm going to give you 13 reflections on what I've been through over the last while. And here they are. I'm not sure if you can see them. He said, Never before have presidents and prime ministers and the media been focused on global health. Never before has there been so many people really focused and looking for people to say, how can you safely get us through some of these challenges? He talked about health professionals needing to have a better narrative, needing to actually not just be responsible for providing what we think is the ultimate truth, but for actually communicating things in a much more digestible way. The idea of actually working with groups and not being so siloed. The idea of that we're much more embroiled with nature and the fact that we have to look at the whole environment and the ecosystem we live in to actually address some of the problems. The fact that we need to be better at facilitating others we need to be good coordinators, we need to show good leadership, we need to actually ethically use the power we have to make change in the right way. We have to be sensible about using data and not be concerned about hiding it and protecting it and dealing with the ethics involved in that. So basically he was saying we really need to look at things in a different way. We've got to stop doing what we're doing. And he said basically you lot are the leaders that have got to take us through this. And so one of the ways, one of the concepts that has been talked about a lot in terms of this more holistic approach is one that's called One Health. And this is often what you see, a diagram like this that involves humans, animals and the environment. And somehow it's either a Venn diagram with them all circles interrelated or it's arrows like this. And there are a lot of different definitions for what One Health is. But the basic concept is the idea of having a more holistic view that will look at animal health, look at human health, look at the environment that they live in and try and work with people who are dealing with these different areas and to come up with new solutions, not just to infectious diseases, but it very much applies to infectious diseases. And so this is one definition. The health of humans, animals, and the viability of ecosystems are inextricably linked. This is a group called the One Health Initiative, have this definition. They say One Health is dedicated to improving the lives of species, human and animal, through the integration of human medicine, veterinary medicine, and environmental science. It's a bit human and animal focused, and the environmental side seems to be tagged on, but you kind of get the feeling of what people are talking about. And to a lot of people, this is kind of obvious. It's the elephant in the room, really. You know, this is something that actually, and to many cultures, this is actually just the norm. It's the way health is viewed in a much bigger scale. But it's not something that we've always done so well in the traditional health professions. And many organisations have signed up to One Health principles, so pretty much every public health organisation in the world talks about One Health and endeavours to follow the principles. And to make things even more confusing, there's this term eco-health as well. And in fact, it's a very similar concept, but come about in a different way from different people. So this has come about more from social scientists, from people involved in ecosystems and the environment, whereas the One Health is very much profession-driven, dominated by vets and doctors. But in the end, it's probably a very similar concept. And there's a belief that actually the two areas are converging quite rapidly, and some people choose which one they're talking about depending on the purpose. So if you want to talk more about social science and the environment, you call it eco-health. If you're really talking about getting different professions together, they might refer to One Health. And this paper was written recently. They're saying, well, actually, is it just same wine in different bottles? And so this year there is the first conference that brings people together, the first big conference. It's in Melbourne in December, and there'll be looks to be a very good meeting that's trying to bring people with these interests together. There are journals on each one, and one called Eco-Health, one called One Health now. And in fact, they had confusion as to all these definitions. One of the themes for Eco-Health is One Health. So we're pretty much talking about the similar sort of thing, this more holistic approach. And like everything nowadays, there's a day. And this is the first time, so November the 3rd this year, it's the first One Health Day. I think it's the day before World Pneumonia Day, I think as well, which is November the 4th. So it's, every day now I think has a disease or something related to health. So there'll be activities this year about One Health. And just getting back to the logo, I think it's something that people struggle with also. I'm not sure this is the logo that's right and people change it because it really doesn't put the environment as a kind of overarching discipline. And I think probably what might be more like is something like this, where it's kind of got the environment is encompassing everything else. And then other people fiddle around with other ones and add other concepts as well. But in the end, pretty much talking about the same thing. It's the idea of having a more holistic approach that takes into account these variables and uses the skills that people have who are expert in these different areas to try and solve some important problems. Now, one thing that's not just about zoonoses. Now, zoonoses are infections of animals that are naturally transmitted to humans. And this has been a focus of a lot of One Health because it's been dominated by vets and doctors. And this is definitely not what One Health is all about. But it's an important part of it. So I'm just going to spend a little bit of time talking about some zoonoses and show you some examples of them. And also you'll, through that, probably see ways of which a One Health approach, looking at the different elements, are really important in terms of trying to develop solutions to control some of these infections. Now, there's a whole variety of what we call zoonoses, and they can be some of the names you may be familiar with, but some can be acquired from wildlife, some from food animals through the food chain, and some from domestic animals. We tend to focus on the human side, and this graphic is actually from Animal Medicines Australia, and it has a veterinary focus and saying there's actually a huge burden of disease among the animals and livestock. So in terms of the expense, in terms of the actual illness itself and the lost productivity, and also the expense involved in vaccination as well. But we tend to more focus on the human side, those of us in human health. And these figures have been bandied around a lot. I don't actually know where they come from, but I think they're probably reasonably accurate. And it's generally thought that about 60% of known human infections have an origin in domestic or wild animals, and that about 75% of what we call the emerging infectious disease, so these are just the ones that have appeared over recent time, have some connection to animals. And then about 80% of the microorganisms that are potential agents of bioterrorism, things like anthrax, for example, are ones that are often diseases of animals. Now, in New Zealand, like so many other countries, there is a list of notifiable diseases. These are diseases that, if they're diagnosed, we need to actually let the local public health units know by law. And this is either because it's a disease that requires an urgent response, or it's a disease where it's important to have ongoing surveillance and monitor. Now, you won't be able to read it because I've just taken it directly from one of the publications, but most of them are infections. And what I've highlighted there are those in yellow are those that have an animal link in terms of a zoonosis. So as you can see, there are quite a few of those notifiable diseases. Now, I'll give you some examples of them. And again, just to really illustrate the types of areas that a One Health approach might be able to address in different ways. Now, I'll start with a really obvious one, and that's fortunately a disease that we don't have in New Zealand, that's rabies. But people tend to think of that as a typical infection you get from an animal. And this is a terrible disease. It's caused by a virus. It can infect many different mammals, probably all mammals. We tend to associate more with dogs. And when they get infected, their behaviour changes, it affects their brain, and amongst other things, they might have a greater tendency to bite people and therefore transmit the infection. And if you get the infection, it's invariably fatal. So it's a very nasty disease. As I say, it's a great thing that we don't have it in New Zealand. But there are ways to prevent it through dog control, through vaccination, and through other means. Influenza is in that one, perhaps something closer to home, and influenza has important links to a variety of animals, and we particularly think about birds and pigs. And influenza, as you're probably aware, is a group of viruses that adapt very quickly. They change every year, and it creates a real problem for us when we're trying to develop a vaccine because it's changed. And so the vaccine that we have this year may be better against the virus we had last year than it is about the virus we have this year. And this evolution, we believe, is important stages are when they go through stages in particular birds and pigs as well. So in in terms of the evolution and sometimes the acquisition of these viruses, the animals play a very important role. And there are other respiratory infections. You might remember SARS from about 2002, this big outbreak out of this severe acute respiratory syndrome. We now know it's due to a virus called a coronavirus. It happened in great secrecy in southern China. There was the information took a long time to come out about this mystery disease. And then, of course, it spread to neighbouring countries. And then through air travel, like we probably hadn't seen it before, it was little epidemics occurred in other places introduced through travellers. And the one in particular was the large outbreak in Canada, particularly in Toronto. And we now know that this is a virus that probably has been around for a while. It's probably one in these civet cats in Asia and bats. Probably was a naturally transmitted between them, and there was something that brought that cycle closer to humans and introduced it into humans, and that spread very rapidly. And there's a more recent one called MERS. These acronyms appear all the time, but this is Middle East Respiratory Syndrome, another coronavirus, one that's been focused in the Middle East, and the cycle that seems to be important among bats and camels, so close contact with camels. But if introduced into humans, there is transmission between humans. And these are where the cases have occurred up until fairly recently, mainly focused on the Middle East. But then we had in South Korea this outbreak. And this was due to a single traveller who travelled from the Middle East back to South Korea. And there were issues. It's always easy in hindsight to look at the problems, but there were clearly issues about border control and recognising that he was unwell. There were clearly issues about infection control in the hospital, because a lot of it, the spread and the cases in South Korea were transmitted among hospital staff and other patients in the hospital where he went. So that created a whole lot of problems for us. And so it's not just health professionals that are involved in this game of trying to control some of these infections. Ebola we've talked about, and one of the major lessons learned from the recent Ebola outbreak was that the importance of social scientists and the anthropologists, and they weren't brought in early enough. And the fact is to actually convey in a culturally appropriate way some of those important infection control measures, how to deal with dead bodies in a way that's going to be acceptable and followed, because those infection control measures are vital to controlling Ebola. So that's a major lesson was, amongst others, was involved that other discipline that was something we hadn't thought about before. And this Ebola has an important cycle among animals as well. Again, you can see the bats. Bats feature a lot for a variety of reasons. And probably, from what we understand, the virus has been maintained in very remote areas of Africa, maintained in, among bats and other mammals like primates. And then occasionally these outbreaks in humans occur through some contact between humans, where humans encroach on that environment and then spread it back into other communities. I have to mention ZIKA, and of course this is very topical, mainly almost exclusively because of the effect. As a disease, it's a roughly mild disease, but because of the effect on pregnant women and development of babies in utero, that's really where all the concerns come from. And this is a graph showing where recent cases of ZIKA infection have occurred. And this is Bruce Aylward from the World Health Organization showing a map of the mosquito vector that transmits it. So this is a virus that is transmitted by particular mosquitoes. And so it's actual, where this disease will occur in the world among humans is almost totally determined by where this particular mosquito, there's actually more than one, but one mainly, where it actually lives. And this is a map of potentially where ZIKA could spread in the world. So it's actually quite a wide range of areas. And again, there is the cycle where it's probably maintained in remote areas between other mosquitoes, transmitted between particularly other primates, and somehow it's jumped across into humans. Now back to closer to home. Just examples of some zoonoses in New Zealand. Campylobacter is a bacteria or a group of bacteria that cause diarrheal illness, which can often be very severe. It's been particularly common, disproportionately common in New Zealand. And this is probably the most commonly reported foodborne disease in New Zealand. It's typically associated with eating meat or undercooked poultry in particular, and milk. And in New Zealand, it's been particularly associated with poultry. Now, Michael Baker's in the audience today, and Michael has played a key role in recognising the increasing incidence through the previous decade of the incidence of Campylobacter infection in New Zealand, and then rallying and trying to raise the concern and getting stakeholders interested and responsive to try and reduce the impact of this infection, reduce the incidence rate, because it reached alarming levels, and there was things that could be done about it. And I'm sure Michael's happy to talk at length about the problems that he encountered and the fight he very much led along with others. And in fact, this is one of his papers where you can see Nigel French is a vet, and there are it was a multidiscipline approach, and it needed to involve obviously the food industry as well. And it wasn't until a strategy was introduced that the incidence declined. Just to mention another one that's related to wildlife in New Zealand. Can anyone remember all the sparrows dying about 15, 16 years ago in New Zealand? And this was related to a particular strain of salmonella. It caused a bit of, it was worrying at the time. People didn't know what it was due to, and it was related to this particular strain of salmonella we call DT160, and this appeared and is largely transmitted around New Zealand by sparrows. And you can see an example of this photograph here of a sparrow, how it might be transmitted to humans. There's an obvious way there. And it was also a bacterium that eventually was also introduced into other birds and other farmed animals. Now I've got a graphic here, thanks to Nigel French from Massey University. This is the data, and it's what it's going to show is a little movie that shows the transmission through the country, which we think is largely due to the activity of sparrows in transmitting it. And what we see is the blue and the purple. These are all individual cases of salmonella infection in humans that has been reported. The blue and the purple are ones that we've seen for a long time that come up every so often. And this bright green one is this particular strain, the DT160. And what you'll see is it start around Christchurch in the South Island and very rapidly spread to the North Island. And if the graphic moves, and then become established after a while, and this is over about 9 years, as a very common cause. Started to decline after about 2011, although it's still around. But as you can see, very rapidly spread up to most of the country. On there. Another one I'm going to mention, because it's an occupational infection, in fact it's the most common occupationally acquired infection in New Zealand, that's called leptospirosis. And this is a bacterial infection due to this leptospirobacteria, which has it's a spiral-shaped bacteria. And it causes quite a nasty infection with fever and headaches, and it can have some nasty complications. And this is one that for most of the world is actually one which is associated with rodents. And rodents become infected, they will pass it in the urine, and it's actually exposure to the urine, either when the urine is in the water source that people are exposed to, or more directly. And we think humans acquire it because they have a cut, and they be exposed, they get through a cut, or it gets in their eyes. And there are other animals, but it's the rodents that we think of the association most strongly. But actually in New Zealand it's quite different. It's actually in some of our livestock, sheep, cattle, and so those at most risk of acquiring leptospirosis are those who are exposed occupationally, so freezing workers and dairy farmers. And it's quite easy to see with this fantastic New Zealand inventions of milking sheds how if a cow decides to pee, how it might someone might acquire leptospirosis that comes out nicely at eye level. So, and the vets are very keen to eradicate this. So there's a major effort in terms of vaccinating animals and trying to minimise the impact of this infection, which is under-recognised in this country, even though we know it is the most common occupationally acquired infection. Now, as I say, it's not just about zoonoses, and I thought I'd talk about another one, which is something that I've spent a lot of time thinking about, is Legionnaires disease, and this is one where the association is more of the environmental side of things. And Legionnaires disease is a type of pneumonia caused by a specific bacteria we call Legionella, or group of bacteria. And it's often quite a nasty pneumonia. It's one we tend to associate with water. We think of it in terms of the water in cooling towers and these outbreaks that have happened all around the world, where there's been suddenly a lot of cases of people have been exposed to air conditioning in a hotel through the infected cooling tower, or it's a spa pool that's become infected. And that happens in New Zealand as commonly as it does anywhere in the world. But we also have the majority of cases, it has another risk factor, and that's gardening. And this is due to a species that is a little different, called Legionella longbeachii, and this is one that likes to live in soil conditions and compost in particular. And so we have demonstrated that the exposure to compost and potting mix is a particular risk factor. And so here, in terms of trying to control the disease, we need to think about how to minimise that exposure. And of course, this is a very healthy activity, gardening, and only a small proportion of people actually become unwell with Legionnaires disease. So we really need to look at ways that we can keep people gardening, but can protect them, and that may be ways of looking at how we can make the potting mix in particular safe, if that's possible. It might not be possible, or look at ways that we can actually advise people about how to handle potting mix. And this is actually the current Ministry of Health recommendations about how to handle potting mix. And some of the things like wearing masks, I mean, you know how many gardeners are happy to wear masks. It's not many. So I think these have been followed with variable rigour. But anyway, it's something that there's ongoing work about. And interestingly, one of our recent studies showed there might be an association with pets, although that's something we're exploring a bit more closely, so I won't talk about that. But it's interesting from the point of view of there being associations we hadn't previously thought about. And in Canterbury, we're hearing a lot about the issues with dairy conversions and the potential effects on the waterways, the potential effects on animal health, the potential effects on human health. And this is a wonderful area that could have a One Health approach, because at the moment we have a lot of people concerned from different sectors, people interested in water quality, people interested in human health. And there's not necessarily a lot of talk between the groups, but a lot of concern and a lot of very focused activity. And so here's a situation we're actually getting together and trying to get good data, see where the problems lie and how we might be able to solve these problems is actually imperative. And certainly at the moment, I think we're all looking fairly narrowly at what the problems might be. And I think having the more broader approach will actually get the right sort of answers. But this has become, as you might be aware, a very, very hot topic in Canterbury at the moment. And antibiotic resistance, I'm not going to mention much, as I said before, but just to say there is an animal connection. As antibiotics are used by humans and overuse promotes resistance, antibiotics are also used in the veterinary field and often as a kind of growth promoter as well. And in fact, New Zealand is in an interesting situation at the moment where we actually, compared to other countries, use a lot more antibiotics in humans than other countries. We kind of think ourselves as being kind of good, but we're actually not. Whereas in animals, we use a lot less than other countries. And this is an interesting association. It's something that has changed. And there is a real effort among the Veterinary Association to actually minimise the use of antibiotics, particularly as a routine in the maintenance of health of livestock. In fact, there are plans to abolish them altogether for that purpose by 2030. So we have to move a lot further along on the human health side as well. Now, what about New Zealand? And is there an opportunity for us working a bit more along a One Health line in New Zealand? And I think this is very obvious that yes, there is. There are a lot of people interested in infectious diseases. It benefits the health of humans and animals, and also our primary produce in our economy. There are a lot of reasons why we should be working a bit more closely together. Not just infectious disease, but obviously that's my focus, and I think infectious disease in particular lends itself to this very well. And so a group of us are trying to develop this initiative. We call it One Health Aotearoa. It's early days. And its foundation is collaboration between Massey and Otago. And I should say for a start, that's not exclusive. We're a lot of other organisations and Crown Research Institutes and other universities are involved, but the core has really been the collaboration. And I've put Nigel French here, who couldn't make it tonight. Nigel's a vet and a professor from the vet school at Massey, and he is my main partner in crime with this initiative. But what we have in New Zealand, one vet school, and it's a fantastic vet school, it has a fantastic international reputation. We have 2 medical schools, which are fantastic, but they're all at different universities. And although there are interactions, there's probably not as much as there should be, and probably largely related to the distance. So we're trying to rectify that with a collaboration between the vet school at Massey and Otago Medical School. What we're trying to do is just get an alliance of health professionals and other disciplines, all with an interest in infectious diseases, and try and work together to address some of the problems we're facing with infectious diseases. And following the typical One Health principles, are aiming to attain optimal health for people, domestic animals, wildlife and the environment. But I think more importantly, it's the kind of holistic approach and providing opportunities for us to discuss problems and to meet and to develop as the need arises for collaborations, and particularly focused around research, but not exclusively. I think there's a major leadership and advocacy role as well. And the values we've talked about are to have a commitment to the One Health principles, to have very active participation from the various groups and positive engagement with stakeholders. And there are a lot of stakeholders, and it's actually more than positive engagement, it's actually involving stakeholders. That's probably a better way to put it. Making a difference, doing things that are actually going to have an impact and affect policy in the end. Be very responsive. That's the one thing about infectious diseases. Things happen unpredictably. And so to actually be nimble and be responsive, I think that's important to have a group of people who know each other and can say, well, actually, this is where the expertise lies and we can react in this way. And to, personally believe, a global perspective. You can't really understand infectious diseases properly without having a global perspective. They ignore international boundaries, and we need to know what happens elsewhere. But I think this is something that we also have a lot to do with New Zealand, but I think we also have a lot to offer on a world stage as well. There's a lot of expertise in this country. And we don't always in this country have good leadership in infectious diseases, and I think here we have an opportunity to actually, in a constructive way, show that leadership in research, in advocacy, in training, and then also, I think, international leadership potentially as well. And sorts of things we're looking at is just the opportunities to connect, to develop networks and collaborations, encouraging innovation, and an education element as well. Now, if we needed any indication about whether there was any interest in the country, it was from this meet. We've run 2 symposia. The most recent one was in March. They've both been in Wellington purposely, so we engage various government agencies. And within a short space of time, we had nearly 200 people from 43 different institutions come along, talk about a wide variety of aspects, all relating to infectious diseases from different angles. And it was an incredibly positive meeting. The networking opportunities were huge, and it really blew us away, the response to this. So this is something we're very keen to run, hopefully as an annual event. And I think maybe we'll take the opportunity perhaps to engage politicians as well in this, in terms of always having it in Wellington and getting key people to come along and present in front of the group. And talking about the international stuff, I just mentioned one project, and this is a project with the acronym HAZEL. It's based in Tanzania. It's funded from UK, but it has some key people from New Zealand. And so John Crump from Otago Medical School and Nigel French from Massey Veterinary School are key players in this project, which is looking at zoonotic infections in Tanzania within the livestock and meat pathway. So New Zealanders, as we tend to do, get involved in a lot of international projects, and here is one example. And also on the education side, Massey have done some amazing things. They've received funding from European Community and the World Bank to do education training in South Asia on One Health and epidemiology among human health professionals and veterinary professionals, key people who have influence in these countries, the future leaders in these countries in these areas. And they've run a program of training to master's level, which has been, by all accounts, enormously successful. And they have this cohort of ex-students throughout South Asia now who are who know about New Zealand, are very strong supporters of New Zealand, particularly Massey, for what they've done. And I had the opportunity to meet a whole of these students in Kathmandu earlier this year, and some of the brightest students I've encountered anywhere. These are people who are really going to make a difference in their home country. There was 3 vets and 1 doctor and 1 scientist who had been trained in a very practical way, and they were going back. They already had jobs within the service, within the government, many within the government, and they were making a difference. And here was, a good example of what New Zealand can offer. And Massey is a very special place. They even have their own time zone. So this is in the workroom in Kathmandu. They obviously work a lot at distance, and so they had Nepal time and Massey time. And I'm just going to finally mention something else, and it's something that I feel very strongly about, because it's, we often talk about global health as well and One Health, and you can get confused. But global health, something I feel very strongly about, and we have a recent initiative which was started in Christchurch, which is a pilot, which is actually getting our medical students to work real time with medical students in Nepal. And in fact, we've also started in Samoa as well, where they're discussing cases with each other that they each bring from each other's country. So this is what they're doing here, a teleconference with 4 places, our students in Christchurch who are on a paediatric run, and they're talking to students in 4 rural locations in Nepal and presenting cases. So our students were seeing the sorts of cases that we wouldn't normally see in New Zealand, and there were learnings both ways. And this is based around a true partnership and a bi-directional learning experience which we're trying out. And we're hoping that this will, we call it Global Health Classroom, and we hope it's going to expand to other areas, but there's already interest from the vet school in Massey to look at actually how that can be done, because they have connections with Sri Lanka and other places, and actually how we can combine the two. And so we have the vets and the medics working together. So, with technology we can do a lot more than the time zones we can't change, and we can just manage this one. But the technology is helping us do this. So I'm going to finish there. You always come to problems with acknowledgements because of the people you miss out, but there are a lot I haven't, and so I apologise for that, but I have to acknowledge some people, and this is a core group who have been involved, mainly from Massey and Otago, to really get things going at the moment, and particularly with the symposium and other initiatives. So just to acknowledge them and apologise for huge number of others who have shown immense support for this initiative. So I'm very happy to answer any questions.
David, thank you. Lisa has a microphone, so if you do have questions, please introduce yourself and direct them to David.
I've got a specific little question about Legionella and gardening. I'm very good about putting on my mask and gloves when I'm doing potting mix and stuff, but tend to be completely the opposite when I'm up in the garden pottering around. Is it promoted by somewhat anaerobic conditions, as in a plastic bag, or should I really have my mask on when I'm up at my raised veggie bed?
Very good question, and you wouldn't believe how much we still don't know. So in fact, I can't answer your question about the growing conditions and whether having a bag out in the sun or it's been sitting in the garden centre in a certain place for a certain amount of time, because we are trying to address those questions at the moment, but I can't answer them for you immediately. What we do know is that the compost definitely is an exposure, is a risk, and we kind of knew that. But actually, the definitive studies, well, not definitive, but the good evidence has only recently appeared in some of that work we've done in Christchurch. But We weren't able to show conclusively about masks and gloves, but that may be a problem with the study itself, so we still think that's a good idea. The one thing that I do think is good and has come out is washing your hands. So when you're handing potting mix, do wash your hands afterwards, and that's something, and it's part of the current recommendations, but that's something that we've found that's come out quite strongly, that things where your hand comes to your mouth provides an opportunity for it to be introduced. So we're hoping to find out some more information about to answer some of these other more detailed questions, but that's what the recommendations at the moment.
Kia ora, I'm Grant Jones. Professor Murdoch, I was really interested in your outline of One Health Aotearoa and how the veterinary and medical sector are working together, and especially on a global basis. The specific issue that I'm interested in, you made reference earlier in your presentation to a goal which you hope to achieve in 2030. Was that relating to lessening the amount of antibiotics which are used by the veterinary profession to promote improved animal growth and the consequential effect of that on antibiotic resistance? Is that what it's
Absolutely. So that's the New Zealand Veterinary Association have done that. And it may surprise you to know that, I mean, obviously you know that a lot of antibiotics are used in the veterinary world as kind of growth promoters, as kind of thought to be related to the well-being of livestock. And so it's not just given to treat an infection. It's kind of given routinely in some places. And that's been a major focus because the amount of antibiotics used in some sectors around the world is huge, industrial quantities. And so that has been a major focus in different parts of the world. And so the Veterinary Association in New Zealand has really been part of a process that's reduced that. And that's their aim by 2030 to have none at all. At the moment they've reduced it considerably, so such that in New Zealand it's a lot less than a lot of other countries. But that's exactly what it was referring to.
Harking from, is that on? Yeah. Harking on from Margaret's question about Legionnaires, I for years almost bathed in the damn stuff, so can one incidentally immunise yourself against it?
It's a very good question, and you know, we very rarely see it among people who actually work with it, you know, people who are in those factories that produce it. And the companies, of course, say, well, it's because they all wear masks and we look after our staff really, really well. And that may be right, but it's also intriguing because these people are exposed to large amounts. So I can't answer your question, but we ask that all the time. And so we're actually trying to think of ways that we might be able to look at that. And it might be that you get exposed to low amounts over a long period of time and that you're able to develop some immunity. But at the moment, we don't know.
Could you tell me, in some countries, some GPs may be forced to give antibiotics for a mild cold in case they get sued, and I just wonder if there's any pressure put on them to give them an antibiotic.
There is enormous pressure put on GPs. I don't think in this country there's so much the issue about litigation. Other countries for sure. But there are pressures in it, and it's particularly from the patients or the parents. That's probably where some of the greater pressures are, or just the feeling like it is something you can do. And so with a common cold or something where we think it's a virus causing the infection, where antibiotics don't work, the right answer is usually not to prescribe antibiotics, but it can be sometimes with the pressure to do something. So GPs do find the pressure, and that is a major focus of ways to get round that and to help out is in terms of what we call antibiotic stewardship, where we're trying to have the more appropriate use of antibiotics. And so that involves a lot of public education as well, reducing the expectation from people about getting antibiotics. But it's a very real effect, but probably not litigation so much in this country.
Yeah, I'm one of the vets that you've been talking about. However, would you like to pass a comment, or do you have any concerns about New Zealand's enthusiasm and increasing enthusiasm to be wanting to buy and consume unpasteurised milk?
Well, of course, I can't really condone unpasteurised milk. That is the standard I would have. I mean, I think there's very good reason to have to pasteurize milk, and I would strongly support pasteurization of milk. Thank you. Yeah.
I actually have one last question as well, and it kind of segues on from last week. We had a long discussion around the nature-nurture arguments with Professor Poulton around the social determinants of health and other behaviour. And I looked at that map around the incidence of infection and death in the Ebola outbreak 2 years ago. To what degree is there a genetic predisposition to the resistance of or susceptibility to viruses like Ebola, and what do we know about how we can develop an inherent resistance? Because it does seem as though the mortality rates were random. I mean, what do we know in science about sort of genetic predisposition?
We do know that there are some infections where, there are these survivors, and HIV was one where there were people who seemed to be, despite incredible exposure, they seemed to not require HIV infection, but it's also a lot of interest in the survivors of Ebola, for sure. And so there are infections where there are clear indications that there is a genetic component. And believe me, there are a lot of work at the moment looking at those Ebola survivors. So we're going to find there will be some information coming out, but there probably are some host factors. It usually is a combination. So there are some host factors, almost certainly.
Well, I think that underscores the fact that while there's much we do know, there's still a lot that we will learn, and I think that's going to be thanks to fantastic researchers like yourself and others at the University of Otago. So on your behalf, can I ask you to join me in thanking Professor David Murdoch?